Welcome to the Chanel mental health awareness in the United States has evolved significantly over the past several decades, reflecting changing social attitudes, scientific understanding, and public policy. In earlier generations, mental health was often stigmatized, misunderstood, or ignored altogether. People who suffered from depression, anxiety, bipolar disorder, schizophrenia, or trauma-related conditions were often mischaracterized as weak, dangerous, or morally flawed. Institutionalization was once the dominant form of treatment, with patients confined to asylums and cut off from society. This isolation, coupled with a lack of effective treatment methods and an absence of legal protections, meant that mental illness was treated more as a social problem than a health issue. However, modern America is witnessing a transformation in how mental health is perceived and addressed. Public discourse has become increasingly empathetic and informed, as scientific research, advocacy efforts, and media exposure have converged to change the narrative. Today, mental health is recognized not just as a medical concern but as a vital part of overall well-being, intersecting with education, employment, housing, justice, and human rights. The rising awareness has been propelled by increased visibility of mental health struggles among celebrities, athletes, and public figures. When someone in the spotlight speaks openly about their experience with depression, anxiety, addiction, or PTSD, it resonates with millions of people who may be experiencing similar feelings in silence. These personal stories are powerful tools for normalizing mental health issues and breaking down long-standing stigmas. Moreover, social media platforms have allowed for real-time sharing of mental health journeys, creating supportive communities where users can offer empathy, advice, and encouragement. This peer-to-peer support model has gained popularity, especially among younger generations who are more likely to talk openly about therapy, self-care, emotional resilience, and psychological trauma. Mental health hashtags, digital campaigns, and online therapy tools are making mental wellness part of everyday conversation in a way that was previously unimaginable. The democratization of these discussions has helped challenge the idea that mental illness is rare, abnormal, or shameful. Meanwhile, scientific advancements have deepened our understanding of the brain, behavior, and emotional health. Mental illness is now recognized as a complex interplay of genetic, environmental, neurological, and psychological factors. Disorders such as depression and anxiety are understood to have biochemical components, and imaging technologies like fMRI have revealed how different mental states correlate with changes in brain activity. These insights have contributed to the development of more effective medications, evidence-based therapies, and holistic treatment approaches. The integration of psychiatry with neuroscience, psychology, and behavioral health has led to multidisciplinary models of care that can be personalized for each patient. Cognitive behavioral therapy, dialectical behavior therapy, EMDR, and other modalities offer structured methods for addressing emotional dysregulation, trauma, and negative thought patterns. At the same time, holistic practices like mindfulness meditation, yoga, expressive arts, and nutritional psychiatry are being used alongside traditional approaches to promote recovery and resilience. Despite this progress, the United States continues to face significant challenges in the field of mental health. One of the most pressing issues is access to care. Millions of Americans live in mental health professional shortage areas, where psychiatrists, psychologists, and licensed therapists are scarce or unavailable. Even in urban centers, the cost of therapy or medication can be prohibitive for those without adequate insurance coverage. Mental health parity laws, which require insurance providers to cover mental health services at the same level as physical health, have been enacted but are not always enforced effectively. As a result, many people delay or forgo treatment altogether, allowing their conditions to worsen. The burden of untreated mental illness is staggering, contributing to homelessness, unemployment, substance abuse, domestic violence, and incarceration. It also affects physical health, as chronic stress and emotional distress can weaken the immune system, increase the risk of cardiovascular disease, and complicate the management of conditions like diabetes or chronic pain. Young people in the United States are facing a mental health crisis of alarming proportions. Rates of depression, anxiety, self-harm, and suicide have been rising steadily among teenagers and young adults. Experts attribute this trend to a combination of factors, including academic pressure, social media comparison, cyberbullying, family instability, and economic uncertainty. The COVID-19 pandemic exacerbated these stressors by disrupting routines, isolating students from their peers, and increasing family tensions. Many schools have responded by implementing mental health curricula, hiring school counselors, and partnering with local clinics to provide services on campus. However, the demand often far exceeds the supply, and students may still struggle to receive timely support. Initiatives like mental health days, peer support programs, and mindfulness training are gaining traction, but systemic change is needed to ensure that mental wellness is prioritized in the same way as academic performance or physical education. The workplace is another critical arena for mental health awareness. The traditional culture of overwork, competition, and presenteeism has taken a toll on American workers, leading to burnout, disengagement, and emotional exhaustion. The pandemic forced many employers to rethink how they support employee well-being. Remote work, flexible schedules, and mental health days have become more common, as companies recognize that a healthy workforce is a productive one. Employee assistance programs, wellness apps, and corporate therapy services are increasingly offered as part of benefits packages. However, stigma still persists in many industries, where workers may fear that disclosing a mental health issue could lead to discrimination or job loss. To counter this, some organizations are training managers in mental health first aid, encouraging open dialogue, and cultivating environments where emotional honesty is not only accepted but valued. These efforts are slowly shifting workplace norms toward a more humane and sustainable model. Criminal justice reform intersects with mental health in urgent and complex ways. A significant portion of the incarcerated population in the United States suffers from untreated or undertreated mental illness. Jails and prisons have become de facto mental health institutions, often without the resources, staff, or expertise to provide adequate care. This leads to a cycle of arrest, incarceration, deterioration, and reentry, with little chance of rehabilitation. Police officers frequently encounter individuals experiencing mental health crises, but may lack the training to respond safely and compassionately. Tragic outcomes, including fatal shootings, have prompted calls for reform. Some cities are experimenting with crisis intervention teams, corresponder models, and mental health diversion programs that direct individuals to treatment rather than jail. Mental health courts and community-based reentry services are also helping to break the cycle of criminalization and create pathways to recovery. However, these programs require sustained funding, political will, and cross-sector collaboration to be truly effective. Veterans are another population for whom mental health awareness is critical. Many service members return from combat with invisible wounds, PTSD, traumatic brain injuries, depression, and moral injury that can severely impact their quality of life. The Department of Veterans Affairs has made strides in expanding access to care, offering therapies tailored to military experiences, and supporting veteran peer networks. Nonetheless, barriers such as stigma, long wait times, and bureaucratic hurdles still exist. Suicide rates among veterans remain high, underscoring the need for targeted prevention efforts. Programs that integrate mental health care with housing assistance, job training, and community reintegration have shown promise, but require ongoing investment. The broader public also plays a role in supporting veterans by fostering understanding, empathy, and social connection, which are vital components of healing as mental health becomes a more visible and accepted part of American life. The role of policy and advocacy grows increasingly important. Grassroots organizations, nonprofit mental health alliances, and advocacy groups are lobbying for legislative reforms that expand access, protect rights, and fund research. Mental health awareness months, national days of action, and public education campaigns help keep the issue in the spotlight. Influencers and activists are using their platforms to demand better care, call out systemic inequities, and destigmatize therapy. At the state and federal levels, there are ongoing efforts to integrate mental health into broader healthcare systems, address workforce shortages, and invest in early intervention. School mental health bills, Medicaid expansion, and funding for community clinics are just some of the policy levers being used to close gaps in the system. Mental health equity, ensuring that all people, regardless of race, gender, income, or geography, have access to quality care, is a central goal of these movements. The cultural conversation around mental health in the U.S. has also been shaped by diverse voices. Historically marginalized communities, including Black, Indigenous, Latinx, Asian American, and LGBTQ+ populations, have unique mental health needs and face systemic barriers to care. Racism, discrimination, intergenerational trauma, and cultural stigma can all impact how individuals perceive and seek help for mental health issues. Culturally competent care, which respects and integrates patients' cultural backgrounds, is essential to effective treatment. Therapists and organizations that share cultural identity with the communities they serve can help build trust and break down reluctance. Representation in mental health professions, training in cultural humility, and translation of services into multiple languages are vital steps toward inclusion. Awareness campaigns that center these communities' voices, experiences, and healing traditions are helping to create a more equitable mental health landscape. Faith-based organizations, artistic expression, and traditional healing practices continue to play an important role in many Americans' mental health journeys. Churches, mosques, temples, and other spiritual institutions often provide emotional support, guidance, and community belonging that can buffer against mental distress. Poetry, music, visual art, and storytelling have long been used to process trauma, celebrate resilience, and express inner struggles that words cannot always capture. Creative therapies and trauma-informed artistic programs are being used in schools, prisons, hospitals, and community centers to engage people who might not respond to conventional talk therapy. These diverse healing modalities recognize that mental health is not one-size-fits-all and that emotional healing is deeply personal, cultural, and contextual. The digital age has brought both challenges and opportunities for mental health awareness in the United States. On one hand, the constant bombardment of news, social comparison through social media, cyberbullying, and digital addiction can exacerbate anxiety, depression, and attention disorders. On the other hand, technology has revolutionized how people access mental health resources. Teletherapy has become a lifeline for individuals in rural or underserved areas, breaking down geographical and logistical barriers to care. Mental health apps now offer guided meditation, mood tracking, cognitive exercises, and virtual support communities, often at low or no cost. Artificial intelligence is being integrated into mental health platforms to analyze patterns in speech or behavior that might indicate a crisis, allowing for earlier intervention. While concerns about data privacy and the effectiveness of some digital tools remain, the potential for technology to expand access and provide immediate support is undeniable. Schools, employers, and healthcare providers are increasingly incorporating these tools into their mental health strategies, especially for younger, tech-savvy populations. In recent years, there has also been a growing movement toward trauma-informed care across many sectors of American society. Trauma-informed approaches recognize that many individuals have experienced adversity that affects their emotional and psychological functioning. Rather than asking, "What's wrong with you?" providers are encouraged to ask, "What happened to you?" This shift in perspective reduces blame and increases compassion, helping create safe and supportive environments for healing. Schools that adopt trauma-informed practices may implement restorative justice instead of punitive discipline, offer mental health counseling on-site, and train teachers to recognize signs of trauma. Hospitals, homeless shelters, child welfare agencies, and law enforcement agencies are also adopting trauma-informed frameworks to avoid re-traumatizing vulnerable individuals. This broader cultural shift is helping to embed mental health awareness into everyday interactions and institutional practices, making emotional well-being a collective responsibility rather than an individual burden. Mental health awareness also intersects with the broader movement for workplace wellness. More companies are beginning to realize that mental health is not a private matter kept at home. It comes to work with employees every day. Stress, anxiety, depression, and burnout directly affect productivity, retention, and job satisfaction. As a result, many employers are embracing holistic wellness initiatives that go beyond physical health. Flexible work arrangements, quiet rooms, employee resource groups, counseling services, and mental health training for managers are becoming more common. Some companies have gone even further, implementing 4-day workweeks, offering unlimited mental health days, or organizing retreats focused on mindfulness and team bonding. These efforts signal a growing recognition that human beings are not machines and that nurturing emotional well-being is good for both people and business. Another significant force driving mental health awareness is the growing body of research connecting mental health to physical health. Chronic stress, for example, is known to contribute to inflammation, high blood pressure, digestive issues, and a weakened immune system. Depression is linked with increased risk of cardiovascular disease, obesity, and diabetes. Anxiety can manifest in physical symptoms such as muscle tension, headaches, fatigue, and insomnia. On the other hand, good mental health is associated with better immune function, quicker recovery from illness, and longer life expectancy. These findings reinforce the idea that mental health is not a separate issue but a core component of overall health. As a result, many healthcare systems are moving toward integrated care models where mental and physical health are treated together, allowing for more comprehensive and effective interventions. Public education is also playing a key role in raising awareness and reducing stigma. Mental health literacy, the ability to recognize, understand, and manage mental health conditions, is increasingly being incorporated into school curricula, community programs, and public service campaigns. Teaching children and adults how to identify symptoms, seek help, and support others fosters resilience and early intervention. Public service announcements, documentaries, podcasts, and influencer-driven campaigns are using storytelling and emotion to connect with audiences and change perceptions. Initiatives like Mental Health First Aid offer certification programs that teach people how to assist someone experiencing a mental health crisis, similar to CPR for emotional emergencies. These educational efforts are crucial for building a culture where mental health is understood, respected, and prioritized. In politics and government, mental health has become a bipartisan issue, with growing recognition that emotional well-being affects every aspect of national life from productivity to public safety to military readiness. Federal initiatives have included increases in funding for the Substance Abuse and Mental Health Services Administration, SAMHSA, grants for school-based mental health programs, and incentives for training mental health professionals in underserved areas. The 988 Suicide and Crisis Lifeline, launched as a nationwide emergency number for mental health crises, represents a major step forward in creating an accessible, stigma-free entry point for support. Lawmakers across the aisle are also exploring ways to address the mental health provider shortage, reduce suicide rates, and integrate behavioral health into primary care. At the same time, advocacy groups continue to push for greater accountability, transparency, and inclusivity in how these programs are implemented. Mental health awareness is also being shaped by grassroots activism and community-based initiatives. In cities, towns, and neighborhoods across the country, people are organizing support groups, hosting workshops, and creating safe spaces for healing. These initiatives are often led by individuals who have lived experience with mental illness and understand the importance of peer support. Community mental health centers, nonprofit organizations, and mutual aid groups provide culturally relevant, low-cost, or free services that fill gaps left by the formal healthcare system. Whether it's a church offering grief counseling, a library hosting mindfulness sessions, or a local cafe displaying suicide prevention resources, these community efforts demonstrate that mental health care doesn't have to be clinical or institutional. It can be relational, grassroots, and deeply human. While mental health awareness has made great strides, many challenges still remain. The U.S. continues to grapple with a significant shortage of mental health professionals, especially in rural areas and among populations that speak languages other than English. Wait times for therapy or psychiatric evaluations can be weeks or months long, even in well-resourced cities. Insurance coverage for mental health services varies widely and may not include all forms of care. Out-of-pocket costs can be prohibitive, particularly for those without employer-sponsored insurance. These systemic barriers create inequities in who gets help and who doesn't. Efforts to address these gaps must include expanding the mental health workforce, increasing funding for community-based care, and enforcing mental health parity laws more rigorously. Stigma, while reduced, still persists, especially among older generations, certain religious communities, and men. Many people still believe that seeking therapy is a sign of weakness or that mental illness is a personal failure. These beliefs can prevent individuals from